the capital city, it's going to be back to the lockdown. But what is going to be allowed during this duration, the dates of which are 19th to the 30th of June?
Well, it seems like once again we're going back to the months of April and May where we had a total lockdown. So it's the same kind of formalities have once again been forward. The interesting factor here is that there was a rumor that there might a total lockdown can once again be implemented in Chennai, but the chief minister just last week said that it is completely false. And right now, after a cabinet meeting and speaking with all the medical committee members, he has come forward and said that Chennai, Chengalpattu, Tiruvallur, and Kanchipuram, these are the neighboring districts of Chennai, will undergo another total lockdown from 19th of June to 30th of June, and not just that, 2 Sundays in between these days, that is 21st June and 28th June, it will be a complete lockdown. And not just that, just like earlier, only essential service items will be allowed. Rental cabs and auto rickshaws will not be allowed unless and until they are helping someone in emergency. Those vehicles will not be allowed. Private institutions, it seems like only essential, works are allowed. Hotels can go ahead and only provide parcel services from 6 a.m. to 8 p.m. And vegetable shops and grocery shops can function from 6 a.m. to 2 p.m. That too in non-containment zones. Government offices, be it central government or state government, 33% workforce can function. And not just that, any person who is coming from a containment zone in working in a government office are requested to not come and just inform their officials. So once again, Tamil Nadu is going back to the condition of April and May with this lockdown. That will be that will start from 19th of June.
All right. Pramod, those are the details, of course, along expected lines on what to expect from this lockdown. We've lived through 2 months of the lockdown earlier, but this time, of course, state government deciding to impose them and giving enough time. So today is the 15th. In about 3-4 days here, 19th onwards, is the lockdown across these certain cities in Tamil Nadu that you specified. Please stay with us. We're continuing with the focus here in Tamil Nadu, and this is specifically Chennai, capital city, which is of biggest concern there in the state because it continues to see a rise in the number of cases, particularly in the past 2 cases, which has been a sudden spike. And this is concerning the death toll of the last 2 days. Second day in a row on Sunday that the city recorded most number of deaths that it had ever. 13th of June, Chennai reported 22 deaths till it rose to 31 further the next day on the 14th of June. But on what has been noticed in this death toll, that these are not cases of COVID plus comorbidity conditions. These are cases of entirely healthy people with no preconditions, with no comorbidity conditions, who have passed away, succumbing entirely to COVID-19. Our correspondent Pramod is getting us further details here on this. Pramod, this means you have entirely healthy people who are succumbing completely to conditions of COVID-19, which hasn't involved a combination of any other comorbidity conditions.
Well, certainly certain amount, a number of questions have not yet been answered by the health department. In fact, on Tuesday, the former health secretary who was recently transferred, she went ahead and said that people are actually finding a new sort of condition in the people who have passed away due to COVID-19, something called as silent hypoxia. Hypoxia is a term which means that the body is losing its ability to absorb oxygen. And she coined the term silent hypoxia. But before she could go or give us any kind of explanation on it, she got transferred. These questions were once again put ahead with the new health secretary. The first one being that for the past 2 days, the number of deaths in this, reported from the state of Tamil Nadu is extremely high, 30 and 38. First day, he mentioned that the number was high because the cases that were reported from the private hospital were delayed reports, and that's the reason. So we tried asking for the 38 cases that were reported yesterday. We are still waiting for an answer. And just like you mentioned, we also coined about number of people who are dying without any comorbid conditions also rising in the state of Tamil Nadu. For this also the health officials state that they are looking into the matter and they will provide an answer. But the situation is definitely grim when it comes to Tamil Nadu now.
Pramod, many thanks for getting us those details here. Another added concern here as far as Chennai is concerned.